that we have in hand is titled Enhancing Patient Experience with Brief Outline and Introduction of, it's going to be by Dr. Pillay. So I'll give you a little introduction. He has a vast experience and also he is academically rich into this. So moving on to his introduction, he's a senior associate professor and is currently the Deputy Dean for the Management and Research at the Faculty of Dentistry at AIMST University, Kedah, Malaysia. He was formerly the Director of Oral Health Policy and Strategy Planning in the Ministry of Health, Malaysia. He graduated from the University of Malaya and obtained his postgraduate qualification in dental public health from the Royal College of Surgeons, England. He is guested as a consultant dental specialist in public health in the National Specialist Register. He has published research papers, among others, on infection control practices in dental clinics, dental anxiety and oral health literacy among patients, as well as presented papers at the FDI World Dental Congress in New Health 2014, 35th Asian Pacific Dental Congress, KL, and Commonwealth Dental Association International Scientific Convention, Sarawak, among others. So, sir, may I please request you to start with your presentation for the day?
Thank you very much, first of all, for the opportunity to be able to give this presentation by Kaho as well as Asqua. So I'll be just sticking on. I won't go into other aspects, which probably will be covered by all the other speakers. So I will just go on to how do we enhance patient experience in dental practice. So I think the most important is we have to beat our competitors. So we have to go the extra mile. So how do we actually create a superior patient experience? So we have to stand out and make the patient experience one that captures and keeps patients. I think that's very important. And whatever we are doing now, we also have to review. Do we need to actually improve it, or we carry on with our current practices? And we need to actually get some kind of feedback about patient experience, whether we are actually living up to patient standards, and more importantly, our own standards. As was mentioned, when it comes to accreditation and also getting our own credentials, it is about our standards. And I think that's important as well, because we need to make sure that we have a high standard of dental care to our patients. That's an obligation. And if it needs improvement, then so what? Where do we go forward? Of course, first of all, where to transform the patient experience. And we know that patient's experience starts before they even step into the clinic. So I think it's quite common sense that our sign, whatever dental clinic that we have, it has to be very striking and visible from wherever the patient is able to see. And does it include your phone number? Of course, it will be good, but of course we have to follow what is allowed in different countries, whether they actually allow you, what is the size of your advertisement or what is the size of your signboards, because I know that in Malaysia, we do have certain regulations regarding size of our clinic signs and also whether what you can advertise. Is your clinic coming up in Google searches? I think definitely that's very, very important. And even better, is it at the top of Google searches? So you get thousands and thousands of Google searches that we can actually get. So we have to make sure that we are at the top. We need to actually maximize publicity using whatever is at our disposal. And definitely what is most relevant nowadays is IT. And of course, going on into AI, I won't touch on that because now that seems to be the ubiquitous terminology, but we will just stick to IT. We want to get featured in local publications. Definitely, if we want to be able to be visible to our patients, we have to do that. And when they go into the portal, we have to definitely have a portal on and also have a website. And we need to have a patient portal. And this, we need to make it very, very, something very different for our patients. so that we can even include a virtual tour of the clinic and with information of the dentist and even the staff who are in the clinic. And this can be put on the websites. Definitely having a portal for patients to make appointments. I think definitely that is, many clinics are already doing that, but it will be one step ahead of our competitors or other clinics if we actually were able to make appointments, and makes it so much easier for our patients, where they can make registrations as well as appointments in the website itself. And even more higher added value will be, of course, allowing patients themselves to update their health information. Of course, this will include extra resources on the part of clinics and even extra expense, but I would say that definitely it is worthwhile and worth the extra budget, and whereby patients can even communicate on opinions before they even come for the dental appointment. They can already communicate with the dental team and also the dental surgeon. We could also allow patients to contact. Definitely, this is we need to do it through text messages. Many clinics are actually doing it, but it actually enhances the patient experience a lot, rather than by just sticking on to phone calls only. The first impressions, I think definitely any patient, we as a patient, when we go in, the first impressions of any clinic or even hospitals, we are also patients in a certain way. And reception is the most important area. And reception area is a much more appealing name rather than a waiting area or waiting room or something. And definitely we need to have a professional image for the reception and waiting area. And reception staff, including those answering the phones, have to be polite, trained, and knowledgeable. So I think that is definitely a key factor, because most patients, they decide at the reception, at the first impression, how good and how much quality a dental practice can provide towards the patient. Enhancing the welcoming experience is not only the signages, the reception area, but more importantly, I think the personalized experience that we, the staff, as well as even the dentist or dental surgeon is able to provide, even when he greets patients. In fact, in AIMS University, we actually tell the students who to come out into the reception area and bring in the patients. It's something which we teach the students, some kind of personalized kind of care for the patients, and they bring them in one by one. Of course, students, they might have more time. I'm sure that many dental surgeons, they are very busy. They might not have the time, but it definitely adds value. If we can greet a person, go out into the waiting or reception area and call them and even bring them in one by one, it definitely will make a big difference. And we know that for patients, and dental care, dental experience is one with a lot of anxiety for everybody. So we really need to make them as comfortable and welcoming. And I don't know, now a lot of clinics, those days, even in Malaysia, if we look at the government clinics, it all used to be a terrible white color. If you enter the reception area, it's white. You enter the clinics, because they say that white gives a semblance of cleanliness and, you know, gives a very clinical look. But I think it adds to the anxiety of patients. So definitely clinics, we can paint surgeries in different hues, nice hues. And very importantly, always make sure that patients, if there's any delay, because we never know, dental treatment can have unexpected complications, and you might need to delay your next patient, but please keep them informed. We definitely need to inform what is causing the delay and keep them informed. And if you can even go to the extent of messaging, in fact, within the clinic premises itself, if somebody, a dental assistant, can message somebody and then message the patient and inform him in a personalized manner what is the cause of the delay, how long you're expected to wait additionally from your appointment time, it definitely is a value-added input for patient experience. Other value-added experiences, definitely, I think these are all quite, many are already being carried out, but I won't really go through it, but I think most of you all can see. For example, like having videos, advertising clips, we can use that as a good soothing music. Definitely many private clinics reading material and comfortable air condition, definitely in our tropical weather is so critical, and beverages and even Wi-Fi passwords to be provided, and it's seen easily. And of course, a kiddie play area for children. Focus and definitely most critically, we have to focus on effective. If we want to implement or enhance the patient experience, we have to focus on patient communication. Listen to patient's communication. Listen before we even open and ask. Listen to what is their concern first. Talk to them, address them by their names, not just a number or that. We get to know their names. Explain procedures, treatments in a way they can understand. I think definitely if you know the patient-dentist interaction, deliberative patient interaction model is better than a paternalistic. I think most of us know that we don't want to be a paternalistic kind of dental surgeon. Rather, we provide information, we provide whatever is necessary for the patient to know, and then let the patient decide. That is the most important patient interaction model, which is a deliberative model. Clear instructions after treatment, a key take-home preventive. I always tell my students, if we have not given that preventive, that 2 minute or 3 minute after each treatment that they provide for each patient, if they don't actually sit down with the patient and talk a bit about prevention, also I'm a public health person, then I think we have not done our part as a professional, because we need to be not just treating, we need to be curing the disease. And we know that dental disease, we have to tell the patient what is the cure. It's just not treating the disease itself and replacing it with some artificial restorative substance or some other artificial implant, but rather prevent future disease. I think that is a very important thing. If we don't have the time in the surgery, at least we can give them a take-home preventive message. Customizing the patient experience, because we have to realize every patient is unique and has different needs. So different patients will have to be, we have to determine what is, this is where the earlier, when the patient is actually registering, it might be good to find out what is their requirements, what would they like, if so that is actually adding and enhancing patient experience and building relationships, even offering anti-anxiety techniques and sedation. All these need to be predetermined actually. It might be a bit too late when the patient is already in the clinic for you to actually ask and do something about it. If these requirements can be predetermined earlier through maximizing IT, definitely it will enhance patients' experience. And we can go on to additional facilities, which will even go one step higher, and even asking patients for some small things, whether they require things like, what is it, a blanket or something like that, okay? This definitely is a touch point. And the wow factor for patients to come, making the patient experience one that wows your patients is very much a business technique. I think today's audience, many, in fact, if not all, are all from the private sector. I don't know whether any are from, many might also be in the government sector, but mostly private sector. Definitely the critical factor in the success of any dental experience and enhancing the experience for patients is for them to return and not negatively impact your practice. So I think that wow factor through all these things, we really have to take into consideration. And I always, even although I'm telling so many times about my patient, about my students' experience, but I always tell the best way to enhance a patient's experience is sometimes we as doctors or dental surgeons, we need to undergo the whole process of being a patient, whether in a medical clinic or in a dental clinic, and undergoing all stages of that process of getting treatment. I think that is the best teacher, becoming a patient yourself. And finally, the bonus that we get is a returning patient, and we get a feeling of satisfaction that we have done our best for our patients and given them the best experience regarding dentistry. So it is also removing anxiety, giving them a good experience of a dentistry and enhancing their feeling about the field. And just to go on the last slide, in Malaysia, we have professional qualifying exam under the new Dental Act, and this is effective from 2022. So it means any graduate who wants to practice in Malaysia will be required to sit for a 3-part professional qualifying. But what I want to emphasize is first part is a normal MCQ and single best answer. Second part is a clinical or root canal and all that. But the third part, which is OSCE, objective structured clinical examination, we have 15 patient stations for this OSCE examination, which is part 3, critical. But what I'm actually emphasizing here is that 50% is actually going towards professionalism and patient safety, 25%. Communication skills, how the patient interacts with the how the doctor interacts with the patient, his communication skills, his caring nature. Is he a patient? He's a patient person. Does he have proper listening skills? Does he listen? Does he talk with a good tone? Does he have proper body language? Is he kind, considerate? All that is taken into account in the communication skills rubric framework before the student or the candidate actually can pass. And actually 50% only comes towards the diagnosing the disease and the clinical management. They have decided that that will be 50%. But the remaining 50% will go towards the first 2 domains, just to go to show the importance of giving patients a positive experience for dental practice. Anyway, thank you for your kind attention.
Thank you so much, sir. It was such an insightful and such a bright, practical shares that you've done. I'm sure all the people, all the audience who are listening right now will definitely be benefited with your wealth of experience that you've shared here. So with this, I'd like to request if there are some questions from anybody's and from the audiences, you may write on the chat board. It will be answered in the end.